So do I believe the answer is yes? Are we there to do it right now? The answer is no. So I do think that, some of the CHIP or CCUS precursors that we understand are high risk for evolution into blood cancers are the ones where early detection and interception play a role. The vast majority of CHIP that you see in aging individuals are not going to progress to leukemia. How they interact with other comorbidities, including heart disease, needs more, definition. And especially if treatments have elements of side effects, you do not want to make the cure of disease more grievous than the endurance of the same. But this higher risk population where progression, is likely to happen over the next several months, if we can detect them and we can intervene, intercept, whether it's with medications or, different modalities such as vaccines against, the mutations, immunotherapy, I think that would be a dream come true, hopefully in the next few years.